Welcome to our exploration of healthcare finance, an area filled with complexity and opportunity. In this session, we'll dive into why financial management in healthcare is so distinctive, touching on the evolving challenges faced by hospitals, clinics, and other care organizations. I invite you to connect with me on LinkedIn for further insights. Let's start with an overview of what we'll cover today. Here's what you can expect in this presentation. We'll begin with an introduction to healthcare finance and explore the unique complexities faced by the sector. Next, we'll discuss the major risks and drivers that impact financial decisions, followed by an overview of the ever-changing regulatory landscape and compliance requirements. Then, we'll look at how technology is transforming finance in healthcare, before rounding out with the vital skills needed by finance leaders today. Finally, we'll wrap up with key takeaways. Let's jump into our first topic: understanding what makes healthcare finance so important. Healthcare finance plays a critical role in ensuring the delivery of quality care. It involves not just funding and resource allocation, but also meticulous management in settings like hospitals and clinics. Unlike other industries, healthcare finance must adapt to unique payment models, strict regulations, and high-stakes decisions that can directly impact patient outcomes. Think of finance here as the engine that powers everything from budgeting and reimbursement to large capital investments and patient billing. Mastering these fundamentals is essential for leaders as they face rapid change and ongoing innovation. Now that we've set the stage, let's look closer at the particular complexities that make healthcare finance such a specialized field. Healthcare finance's unique challenges come down to three main areas: analytics, operations, and payment models. First, analytics are indispensable for forecasting costs and tracking how resources are used. In today's data-driven environment, predictive analytics help leaders focus on improving efficiency and patient outcomes. Next, operations are strongly influenced by fluctuating demand, rigid regulations, and high fixed costs. Financial leaders have to constantly balance cost control, service quality, and long-term planning, all while responding to pressures from both regulatory bodies and patients. Finally, payment models in healthcare blend government reimbursements, private insurers, and self-paying patients. Managing this patchwork requires robust financial reporting and close alignment with care delivery. With those complexities in mind, let's dig deeper into the main risks and financial factors that healthcare organizations must navigate. When it comes to risks and financial drivers, healthcare finance professionals face critical challenges in three areas: forecasting, regulatory risk, and cost management. Accurate forecasting is crucial for capacity planning and budgeting, especially given public health emergencies and shifting patient populations. Leaders need to anticipate trends that could dramatically affect demand for services. Regulatory risk is ever present, with compliance teams working hand-in-hand with finance to manage threats, protect sensitive patient data, and ensure high standards are maintained. Non-compliance can result in penalties and serious reputational damage. Finally, the rising cost of drugs, skilled labor, and advanced technology means that margins are under constant pressure. Financial leaders must negotiate deals and design systems that control these costs and maintain stability. Managing these risks is the foundation of sustainable healthcare finance. Next, let's see how organizations approach compliance and regulatory issues. Strong compliance is the backbone of financial stability and trust in the healthcare sector. It's sustained through continuous education, rigorous auditing, data privacy, and adherence to regulatory mandates. Continuous education ensures professionals remain current on evolving regulations. It's up to finance leaders to champion ongoing learning and a culture of compliance. Audit and reporting processes verify that teams stick to required standards and protocols. Coordination between clinical, legal, and financial teams helps spot issues early and maintain systemic integrity. Data privacy has heightened importance, with patient information needing robust protections to avoid costly breaches and loss of public trust. And finally, regulatory mandates, such as those from HIPAA, the Affordable Care Act, and state programs, require strict controls and frequent reporting. Adapting to new laws and payment systems can require a rapid shift in financial priorities. Now, let's see how technology is helping finance teams tackle these challenges and drive healthcare forward. Digital technology is revolutionizing healthcare finance in several vital ways. Automation eliminates many manual tasks in billing and payments, boosting speed and accuracy throughout finance departments. Advanced analytics tools help spot fraud, monitor resource usage, and predict future costs. By leveraging big data, organizations gain actionable insights for smarter financial decision-making. Integrated workflow platforms break down silos between departments, streamline collaboration, and keep organizations compliant with regulations from procurement through to reporting. Finally, robust security measures protect sensitive data from cyber threats and regulatory violations, safeguarding reputation and financial stability. With the right technology, finance teams can achieve higher efficiency, better compliance, and more patient-centric service. But to succeed in this challenging landscape, finance leaders need specific skills. Let's look at those next. Successful healthcare finance leaders need a dynamic blend of expertise: analytics, leadership, ongoing training, and integration. First, analytic skills allow leaders to interpret large datasets, build performance dashboards, and develop advanced cost models for better decisions. Leadership is about communicating a compelling vision, driving innovation, and fostering collaboration across finance, clinical, and IT teams. Ongoing training ensures professionals adapt to new regulations, technologies, and changing business models, helping teams stay ahead of the curve. Lastly, integration skills help leaders unite finance, care delivery, and compliance, building strong cross-functional teams for patient-centered, sustainable success. Together, these capabilities drive resilience and sustained value in healthcare organizations. Let's close with some final thoughts and key takeaways. In summary, healthcare finance is a field shaped by evolving and unique challenges. Achieving success requires mastery of regulations, staying on top of technological advances, and fostering strong, cross-functional leadership, all with a focus on sustainable, patient-centered value. Thank you for joining me. For more insights into healthcare finance, be sure to connect and continue learning. Until next time.